Oxfam just released its latest household care survey, wherein they found out that Filipino men have been putting more care work hours because of the pandemic. But Filipino women still carry most of the burden. Let's talk about the impact of this survey. Joining us now, Lot Felisco. She is country director of Oxfam Philippines. Lot, nice to see you again. Welcome to the program.
Hi, Carmina. Nice to see you again. Thanks for having me.
All right, let's talk about this survey. Very interesting. Tell us what you found out in the survey that really showed you how the pandemic has changed the dynamics within the Filipino household.
Yes, Carmina, sure. Let me just backtrack a little bit and maybe give a bit of background, because people ask us sometimes, why is Oxfam that's supposed to be working on poverty and inequality? Why are you working on this issue of care and domestic work? And we explain that it's really an issue of inequality and poverty. One, because women have been shown to disproportionately carry the burden of care and domestic work. So that's an issue of inequality. And this disproportionate burden on women actually limits them from economic opportunities, livelihood options, because they're so tied to care and domestic work. So in a way, it's an issue of poverty as well. So we've been working on this for several years now, but we've seen really some changes because of the pandemic. As it happens, we did a survey in early this year. So it was the height of the pandemic, and the survey showed us that a big proportion of men, almost 2/3, reported that they were doing more hours of care work than before. But yes, women still do the larger portion of care work, but we're seeing a shift in that men are doing more. And this leads us to the question of, is this a shift that we hope is here to stay? What can we do to make sure it's here to stay?
Yeah, but let me just follow up on your explanation a while ago about the disparity of it all. How do you reconcile that with a very Filipino notion that women are the light of the home? Ilaw ng tahanan, di ba yan ang tawag natin? And that's why this has been used sort of as a justification that women should only be at home, should only stay at home, and should do nothing else but care for the family.
You're right, Carmina, in saying that those like traditional concepts, they can be used as justifications and mask the reality of really what's there. Because even as we say that women are ilaw ng tahanan and their work is in the home, actually we know women are more than that, right? Women work in the formal economy. Women work on the farms. They're farmers, they're fishers, they're workers in the formal economy, in the informal economy. In fact, during the pandemic, we've seen women really stepping up to do the income generation that has been lost in the formal economy mostly by men. So we know women do more than that, and yet they also do a disproportionately large amount of the care and domestic work that's needed to keep all other work possible. Because that's what it is, right? Care and domestic work is the work that's needed so that everyone else in the family, in the household, can do other quote-unquote productive or paid work.
How do you make this more than just a manifestation of the pandemic and more like the norm, even post-pandemic?
That is the challenge, really. And that's what, Oxfam, we've been working on for many years now, especially in communities that we've been working in, for instance, in Eastern Visayas and in Mindanao. You hit the nail on the head. It's about changing norms. It's about changing people's perceptions and views. For instance, changing how care work is viewed as not really work. It is work because it takes time and it takes people's energy, and it's largely women's time and energy that goes into that. So first of all, we are working so that communities, leaders, and we ourselves, women and men, and our families recognize care work as work. Secondly, that this work is therefore supported both by policy and also investments, because it's not just a woman's burden to take on that work and do it effectively. There has to be support in terms of policy and programs. And then that this work will be redistributed across different members of the family and the community. And to do all that, underpinning all of that change is really a change in how people view it, and an acceptance that this is not just women's work. And I think that's the opening that the pandemic sort of gives, because as more men have been at home and taken on more of the care work and talking more about it, then it's becoming more visible, and in a way, hopefully it's becoming more acceptable. Because before, the norm was if men do care work, they are like, bullied husbands, or they're not.
It's emasculating.
Yeah, it undermines the masculinity. So if that is changed, then that's a very big progress. That's a big leap in making care work more distributed responsibility. And hopefully more supported by policy.
Yeah. When you were conducting the survey, what were the reasons being given to you by the men that were part of the survey?
Well, there were different reasons. One, that they were more home-based, that they've lost jobs. Basically, it revolves around that, because those are the big changes that the pandemic brought: the economic side of jobs being lost and businesses closing, and more work being done from home, either because of being unemployed or because work modalities shifted, and also the school work being done online at the same time.
But Lot, when you talk about, a while ago you said it is work, right? It's there are some who are still of the belief that, it's not work if you love doing it, right? So how do you get through these people who have such a notion without really, eroding the love that is put into whatever it is that they do? Because, for example, we're working, but we also do, as you said, we still do a lot of things outside work, things that we love to do for the family. But you're correct in saying that it's still work. So this survey, is the survey's goal to sort of show women that, or take away the love that is going into the care that they're providing? Is that sort of the goal there? Or what do you want women to see in the results of this survey?
I think, first of all, we want to show how valuable care work is. Like I said, it's the work that makes other work possible. And because it's valuable, it has to be supported, to be done properly, and to be done not at the expense of the women who do it. Because the survey also showed that there's a big number of women who in the last 6 months have suffered injuries or illnesses because of the care work that they have to do. And I don't think it detracts from the love for something that we do if there is proper support for it, right? Because it just makes sure that we do it properly, and we do it in a way that doesn't harm the person who does it. And the experience we've seen, for instance, in the communities that we've worked with in Eastern Visayas, on how women can be supported to do their care work. Because let's imagine these communities. These are rural communities. Women have to walk, even dangerous roads just to collect water for the family, and they've had illnesses because of that. And they've fallen down slopes in stormy weather and so on. So they have to be supported for that. And that's what the government did, was to build laundry points closer to to families' homes, so that women don't have to travel very far to collect water. Things like that, simple things like that.
And look, this is not just, the results of this survey is not just for the women, for the support system to see, but for the women themselves to realize their value. Because I've done stories in the past wherein the women that I've interviewed thought that they were doomed to a life of poverty, that they were doomed to this life that they live, and they weren't even wanting for a way out. It's just a reality that they accept. But you're saying there's a better reality out there, one that could be beneficial to them as well.
Yes, that's really the role that social norms plays, right, in our life, in our belief system. That we need to have that space to reflect on the realities that we have, to reflect on how we can change it so that things can be better. And that goes for in the issue of care work. That goes, like you said, not just for men to reflect on their roles, but for women too, to understand how a family can do better. Like you mentioned earlier, it starts from a very young age. Another thing that the survey found was that indeed the socialization about care work, it starts from a very young age, because what we saw was that girl children in the home do twice as much care work as boys in the same family, right?
Mm-hmm.
So as early as the early years of a girl, it's already normalized that she has to do more of the care work than her brothers.
Yeah. So sorry to cut you there, but then now we go back to the point you were trying to make earlier about changing the norms. And this whole pandemic having an intergenerational effect. This is the perfect situation now, because the young boys see their fathers now sharing in the care work. Might this be the track that's to be followed even post the pandemic? Because this can be an opportunity.
That is our hope, that this change in household dynamics that are sort of forced upon families by the circumstances leads to a change that will last and that will be supported even by policy. And this survey, I have to mention, this is not an Oxfam initiative alone. We worked on this with the Philippine Commission on Women, and I'm very hopeful because the Philippine Commission on Women is showing its leadership for the government and for the country as a whole to understand this issue of care work and how it can be better recognized and better supported for the good of women, and that translates into the good of the family as a whole and the country as a whole. Because the redistribution of care work also has knock-on effects on how a woman is able to take on economic opportunities, not just for the family, but for herself as well. And also has knock-on impacts on her health and her well-being more generally.
Yeah. So as we wrap up this conversation, we're talking about policy. What kind of policies must be shaped to support? We were talking about support system as well. I want to know about possible policies that can make this the norm, help support this to be the norm, even when the pandemic is long gone.
Maybe I'll share an example from the experience that we have working with local governments in Eastern Visayas and Mindanao, where the local governments, upon recognizing the value of care work and how it should be more distributed, shared more equitably, they themselves adopted local policy such that there would be budgetary allocations for investments that would help women reduce the burden of care work. So I gave an earlier example about making water facilities more accessible to women, having daycare centers that are more operational, more effective, so that women have less of the burden of looking after their children for the whole day. And examples like that about allocating budgets for to invest to reduce the burden of care work on women, and eventually then shaping how care work is viewed, and therefore making the changes more lasting and sustainable.
And we're going to have to leave it at that. Lot Felicio there, Country Director of Oxfam Philippines. Always a pleasure talking to you. Continue to take care, Lot. Keep safe.
You too, Carmina. Thank you very much.